Do you ever have pain in your back that switches from one side to another? That's the topic of today's episode of Ask Dr. Walter. I want to welcome you to episode number 6, and what I'm doing is this brand new series. Actually kind of fun to do this series, kind of an informal video that I upload on a daily basis, and what I do is I take one of your questions or a question of one of my followers on YouTube, and I'll answer the question in a video and upload it each and every day. Okay, so it'll be a new video each and every day. So one of your questions and comments could be addressed in the next Ask Dr. Walter episode. And for today, I'm going to answer the question here by the Pawn Star. So the YouTube handle of this YouTube follower is the Pawn Star, PAWNSTAR, the Pawn Star. And this is what the Pawn Star asks. Thank you so much. I felt a bit of relief after doing these exercises. What does it mean if the pain shifts from one side to another? That's a great question, and I've experienced and seen that with many of my patients. They could either be under care or they tell me, throughout the weekend that the pain has shifted from one side to another of their back. So what that means is it depends on which nerve fibers are being irritated by the inflammation, okay, that's in your back. So when there's tissue damage on your back or in any part of your body, right, there's going to be inflammatory chemicals, an inflammatory response, which is the first response by your immune system in your body to start the healing process, the cascade of the healing process, right? So there'll be release of inflammatory products that will create a whole bunch of things like cause pain because it irritates nerves and tissues, causes swelling, causes redness, causes more blood flow. Those are all typical cardinal signs of inflammation, okay? Now, depending on the nerves that are being irritated, you will experience the pain a little bit different. So if there is a pinpoint area that you can literally say, Dr. Walter, I can feel the pain. It's right here, okay? That is a specific nerve fiber that's being irritated. That's an A delta nerve fiber, okay? Now, if you tell me, Dr. Walter, sometimes I have the pain over here, and sometimes I feel it over here, and then other times I feel it over here, and sometimes I feel it between my shoulder blades, the pain's kind of moving around from side to side. Those nerve fibers that are being irritated in that situation are called C fibers, okay? So how you experience the pain depends on the actual fibers that are being irritated, the nerve fibers that are being irritated, and how that information reaches your brain, and then how you perceive that pain location, okay? So why is it diffuse and why does it go from side to side? Because that's diffuse inflammation. It's not specific in one spot that's irritating the A delta fibers. It's diffuse inflammation. Inflammation creates chemical byproducts. So the C fibers, C stands for chemical, it will actually be sensitized in multiple different areas because the inflammation is being spread out in multiple areas of the back. So if one day it's on the right side of the back, another day it's on the left side of the back, another day it's a little bit lower, it's because the C fibers are being irritated by this diffuse inflammation. So you get the appearance and perception that the pain is moving from side to side, okay? It doesn't mean that something's getting worse. It doesn't mean anything to worry about. There's still an underlying problem causing inflammation that needs to be addressed. It just means that inflammation is moving from side to side, irritating different nerve fibers, okay? So hope that clarifies that if you ever had that situation happen to you. So that is the answer to today's question on Ask Dr. Walter. Be sure you don't miss out on any of the future episodes. So subscribe right now, tap the notification bell, and if you want to catch and binge watch some of the past Ask Dr. Walter episodes, go right here, right now to watch that, and you can continue learning on my channel.